Ay, na po na karaoke sa 10-minute version. Anyway, ang daming chika. Ayun, so again, this afternoon, we're going to start now with urinalysis, no? So we're starting first with introduction to urinalysis, and then followed by the first part, which is physical exam. Now, you may be thinking, sir, lahi-lagi ang order ni mo sa imong notes compared to the chapter sa Strassenger. Yes, ako na siyang gituyo, no? Sa Strassenger, mas una ang renal function, ang introduction to UA kaysa renal function. Pero ako siyang i-change, akong iunang renal function for the fact that at least mahuman na to renal function, and then magsugod tag urinalysis, dire-diretso na introduction, physical, chemical, and then microscopic. So at least medyo narrative flow when it comes to the discussion. All right. Now, for this afternoon, again, we're going to start to introduction and then physical exam. All right. Ayan, sige. So you may refer to your notes. So again, this is introduction to urinalysis. Before we start with history, which is the next slide, we have to answer, why do we have urinalysis? Kasi purpose, sir, ano naman tayo mag-analyze of urine? Para sa day na urine naman na. So of course, number one, the first major reason is that through urinalysis, the results of the urinalysis can help, no, in the diagnosis of disease. All right? Because sa urinalysis palang daan, it can already give the doctor an idea, a glimpse of what is possibly causing the symptoms of the patient, no? So urinalysis pa lang, pwede na siya maka-aid in the diagnosis of disease, no? Number two, it can also help in monitoring the disease mismo, and also monitoring the effectiveness of treatment. Especially example, if naka-UTI, di ba? No, if bacterial origin, we'll see if after antibiotic treatment, pag-check sa urinalysis na pa ba yung mga bacteria. So it means na ni-work ba ang tambal or dili. All right? Another is, it can also be used to diagnose, no, and detect mga congenital diseases, especially the genetic ones, no? And what are those? Katong mga inborn errors of metabolism, such as your alkaptonuria, di ba? Mga phenylketonuria, katong mga disease, all right? Which can be detected as early as infant stage, all right? And we can detect that through urinalysis, and we'll have a separate discussion on that, the different diseases, inborn errors of metabolism. So that's the importance, no, of your urinalysis. And sure enough, urine is considered to be the fluid biopsy. Ayan, o, diba? Take note of that. That's according to Brunzel. Fluid biopsy of the kidneys daw ang urine. Nga naman siyang fluid biopsy? It's because biopsy, diba? Fluid. Through the urine, we can already see the different cells, no? The different components of the kidneys or the body that may have contributed to the disease. That's why it's called fluid biopsy. Ang urine daw mismo, fluid biopsy. All right? So that's for the purpose of your urinalysis. So by the name itself, urinalysis is the analysis of urine. Okay, so you analyze urine. All right, sige. So we'll start first with history, of course. It's very important that we start with history because, again, those that do not learn from their history are bound to repeat it. Ang dami talaga, charot. And anyway, so for us here, history, ako nag-include ng people, no, regardless if naba siya contribution sa urinalysis or wala. So number one, you have Hippocrates. Siya nag-start with uroscopy, and he also started the first sputum exam. But even before Hippocrates, no, mga historical na mga artifacts and mga findings, they found out that even as early as the Egyptian civilization, no, sa mga hieroglyphics and all that, there are a lot of doctors na or mga procedures in examining urine. So even before Hippocrates yun, nag-start na sila examining sa urine. Alright? But si Hippocrates tong medyo murag na-note yun siya ba? Like, well-known. Okay? So Hippocrates, uroscopy, first sputum exam. Frederick Deckers, of course, around mga early 1600s or late 1600s, he discovered albuminuria by boiling urine. All right. Followed by, of course, Thomas Bryant, who wrote a book about piss prophets. No, these are mga charlatans or mga quack doctors, mga wannabe doctors. No, so katong mga si Dr. Farah, charot, check lang. Katong mga dili qualified, no, katong mga pasagad lang mention or whatever. No, so mga piss prophets. And then Richard Bright, who was the one who suggested to include urinalysis as part of a routine tests of a doctor. No, true enough, di ba? If ma-ER magani mo, emergency room, di ba? One of the initial tests that the doctor requests is your urinalysis together with CBC, because these two tests usually can give already an initial information as to what the patient is experiencing, no, or what is the disease the patient is suffering from. All right. So that's according to Richard Bright. Ludwig Thudicom, of course, siya nakadiscover sa urochrome. Urochrome is the main pigment, again, that gives your urine its normal color. All right, and we'll discuss that when we go to the physical exam. You have Domenico Cotugno, discovered CSF. All right. Ivan Folling discovered phenylketonuria. Archibald Garrod discovered alkaptonuria. And you have William Wollaston discovered the cysteine calculus. So as you can see, those are the major people, no, mga historical figures. Of course, napay mga lain, no, pero wala na siya i-include kay daghan na kaayo. Alright? So ito na mga major ones, alright? And most of them are coming from Strassinger po na po. In Clean Mic and the board exam, wala man kayo history na mugawas, wala kayo people, no? As I mentioned, if naka-mention ako, most of the historical na mga information, usually mugawa siya sa ISBB or sa micropara, ditong dapita, no? Mga people yun. Pero so far sa akong experience, wala kay history na nigawa sa ato. But usually, good if mugawa siya sa ISBB or micropara. Alright, so that's for history. Alright? Now we go now to, of course, urine, no? The protagonist, no, of our discussion and ang star ng Pasko. Yes, no. So urine, again, what is it composed of? Of course, majority 94 or 95 to 97% it is composed of course, water. It's a fluid, all right? So of course, it's made up of water. And the remaining percentage, 3 to 5, is the solutes, all right? And these solutes has a total mass of 60 grams, all right? 60 grams, which is known as, again, your total solids in 24 hours, all right? And this 60 grams can be divided into two categories. You have 35 grams of organic substances and 25 grams of inorganic substances. And in the 35 grams organic substances, kinsa ganito ang major organic substance found in urine, you have urea. Now take note, urea is a breakdown product, metabolism of your proteins from the food that we eat. All right, take note of that. But aside from urea, of course, we have other organic compounds such as your uric acid, hippuric acid, creatinine, of course, carbohydrates, pigments, fatty acids, mucin, enzymes, and hormones. So again, mga organic substances, no? Those that are involved in biochemical reactions or breakdown products from biochemical reactions. Okay? Now take note of the description of each of the organic substance there. Study sa Strassinger. Na-table dira, no? So again, uric acid is a breakdown product of nucleic acid metabolism. Take note of that. And if specific pag yun, purine metabolism. Ako, gas-gas na gas-gas. Baka itanong, which of the following is a product of nucleic acid breakdown? Which of the following is a product of purine metabolism? Press the buzzer. Atong answer is uric acid, of course. Alam nyo na yarn. Alright? Take note, diba? Purines are part of nucleic acid. And the other counterpart of purines are your pyrimidines. But take note, purine metabolism yun is uric acid. All right. Next, of course, creatinine. Alam niyo na yan. Creatinine is a breakdown product of muscle catabolism. Alam niyo na yan. Okay? So, basta ganyan i-describe siya, alam niyo na. All right? The other descriptions nasa inyong handbook sa Strassinger. All right. Now, for the 25 grams, it's the inorganic substances. And the major inorganic substance found in urine, unsa ganito, you have chloride. Okay? Chloride. And the principal salt is actually sodium chloride. Now, other salts, of course, you have sulfate, phosphate, ammonium, magnesium, and calcium, of course. The major one is chloride. All right. Now, let's say naka-receive kag unknown fluid, no, sa laboratory, and you want to make sure or you want to check if it's urine. Now, what are the analytes that you can test the fluid for para makadetermine ka if urine ba siya or dili? You have creatinine and urea. But if you have to choose between the two tiers, let's say sa exam, no? Ang question dito, which of the following analytes can be used to test if the unknown fluid is urine? And both choices are given. Ano sa inyong answer? Creatinine or urea?
Creatine.
Ano sa to? Ano sa mga answer? If you have to choose between the two.
Creatinine, sir.
Creatinine, okay. Ano sa answer sa uban? Agree ba mo na creatinine?
Creatinine, sir.
Creatinine
Yes, sir.
po, sir Paul. Agree po. Wala yung answer urea. Kaya good. Gusto kitang lawas to lesson. I'm not sure what's happening. Oh my God. Okay, anyway. Ergonomic hazard. Charot. Creatinine, ang answer nila. Sige. Nabay mo contest against the answer. Nabay lahi ang answer. Nabay mo choose of urea. Or agree ra mo sa CREA? Yes? Okay. Wala na? Alright. Sige. So that is very much correct. Tama. No? So if you have to choose between the two dears, answer creatinine. Why? Because it is found in urine, no? Creatinine is in the highest concentration. No? Urea can also be found in other body fluids but in smaller amounts lang. So if you want to determine kung unsa gyud siya, better use creatinine because creatinine gyud is really found in urine. So if ang fluid taas kay creatinine, then you can say that that is really urine. Okay? So if you have to choose between the two, unsa to choose siya. Mahal ko o mahal ako? Mahal ko. Charot. Creatinine. Okay? Creatinine. All right. Very good. Sige. Very good. Okay. Next, we have, of course, specimen collection. So before we start with specimen collection, of course, we have to define first what are the acceptable containers. Of course, alam niyo na yan. Number one, the containers should be clean. It should be dry, leak-proof, and of course, disposable ones are the recommended containers. Now, kabante mo, naka-mention dira, clean. Alright? Take note, kung routine urinalysis lang, walay culture, clean containers would suffice. But if there's culture, of course, kailangan tag sterile. Alright? Now, of course, it should be leak-proof. My gosh, imagine, imuhang container mabasa-basa. No, kaya na ay leakage. So, of course, we have to prevent that. And lastly, disposable ones are recommended, of course, because if reusable siya, the chances of having contamination with bleach, di ba, and mga detergent is there. So, possible na if na-bleach contamination, pwedeng maka-affect sa imuhang chemical reactions in your chemical examination, di ba? So, disposable ones are very much recommended. Now, it should be screw top, of course, because screw top lids will provide much more secure na pagkasarado, all right? And it should be wide mouth, specified siya sa Brunzel, kung sa iyahang diameter, 4 to 5 centimeters. And the bottom should be wide or flat. No, flat na bottom. Okay. So wide mouth, of course, to facilitate the collection of urine for female patients, especially female patients. Okay? It can be a challenge, to collect specimen for female patients. And for wide flat bottom, so that dili siya daling ma-overturn, dili siya daling matumba. All right. Now again, it should be sterile. Again, if na culture, but it's actually recommended that if the urine is greater than 2 hours to be processed, or dili siya ma-process within 2 hours, it's best to use the sterile containers because again to prevent external contamination na. All right. But if it can be processed within 2 hours, pwede na itong mga disposable na dili sterile. Okay. Now again, there are some specially designed sterile containers that they have a lid which we can attach a transfer device known as the transfer straw. Alright? So inani siya dears, mura siya ETS actually, no? So imo ra siyang ipasuyop sa bottle or sa imong container, and then katong tube imo rang ipansa, mura siya ETS, and then mo aspirate na siya urine. Alright? So this is usually used for sanctification or for culture. Alright. Now the capacity, gihatagan mo og range dira ni Brunzel, 50 to 100 ml, but for Strassenger specified yun na 50 ml. So 50 ml dapat ang capacity. And kung timed specimen, mga 24-hour urine, it should be 3,000 ml ang capacity. Of course, remember that 24-hour urine, yung may collect imong tanang ihip in one day. So of course, kailangan kang dakong capacity. Alright? Okay. Now, for the labels, of course, alam niyo na yun. Okay. Labels, minimum information according to Brunzel. The patient's full name, of course. Unique ID number. The date and time of collection. The patient's room number and the preservative used, if any. That's the minimum. Alright? Minimum. So, pwede pang more than the given information there. Alright? Depende na yun sa lab. Depende sa inyong protocol. So, always follow your laboratory's protocol, the institutional protocols. Alright? Ayaw mo pagbuot. Okay? Kung ano silang giingon na dapat na dito sa label mo, mo i-follow. Alright? Especially ka ng mga preservatives na gigamit dears, especially if mo send out mo og mga specimens. Meaning, magpadala mo specimens og lahi na laboratory kay wala mo ani na reagent, dili mo ka-process ID, you have to make sure na i-specify siya sa request form or sa asa magani na nagamit kag preservative para at least ang receiving laboratory makaget sila na, okay, this specimen has this preservative. So mag-expect na sila kung sa mga possible implications that would bring, kaya na may preservative. Alright? Okay, and of course, the labels should always be attached, Should always be attached to the container. Of course, alam niyo na yan. And not on the lid. Because kung naa siya sa lid, what if matangtang ang lid, no? Magka-sagol-sagol na ang specimen, it can lead to misidentification and of course, erroneous results. Alright? Take note of that. Always attached to the body. Alright. Now, let's say, sige, natay situation. Alright. Very common scenario yun here. Samot na mag-hospital assignment na mo next sem. Very, very common, no? Let's say you have one specimen lang, no? Urine, actually urine ang pinaka-common, pero napayuban, no? You have a specimen, urine specimen, nakadawat ka, no? Ikaw ikaw ang assigned sa clean mic na intern, okay? Tapos, naay nihatag nimo na specimen, alright? Tapos, ang urine specimen, usara ka buo, and naa siya request for culture and routine urinalysis. So, kinsa man imong unang buhaton? Nakadawat kang urine ha sa CM na section. Tapos, paglantaw nimo sa request form, naa siya request for both urinalysis and culture. So, what should you do next?
Urinalysis, sir.
Okay. Should you process it for urinalysis or unahon nimo ang culture?
Culture una, sir.
Culture una. Alright. Si Lujay, una niya ang urinalysis. Sige. So may answer sa uban. What do you think? Situational ni ha, dears. May tawag yun sa inyong hospital assignment. Wala ka joke. Ikaw jud mismo naka-assign sa CM. Nakadawat kang ihi. Yan ay culture and urinalysis na request for the same sample. Usara gyud. So what should you do?
Culture, sir.
Culture unahon. Alright. Si Lujay kay urinalysis. Okay. And so may ato ang buhaton. Sige. As an intern. Yes. Ano man? So, saan tayo prioritize una? Ang culture or ang routine urinalysis? Yes, and so may final answer na to. Yeah. Wala na, okay na to. Sa man, culture or urinalysis? Asa man na itong iuna? Ala, yes, ng mga shy type. No, hapit ang mga ng SEM, shy type pa rin. Ano naman, ito yung process una. Don't be shy. Urinalysis, okay. Ala ha, watching you but they have. AUB ang probably ko sa una. Watch out. Alright, sige. Alright, final answer, urinalysis. Ang uban food culture. Asa naman tandiring dapita? Yes. Nako, what if di ay wala ta nagklase ron niya, na mo sa hospital niya. Nakadawat mo ginato na. So may yung buhaton di ay. Okay. So, sige, ako nalim mo ito bago i-Dora man di ay. Anyway, the first thing that you should do, dears, ha, basta gani, duha ka requests, and then usara ka specimen, especially sa urine, since we're talking about urine, you have to prioritize the culture. Culture, good atong unahon, ha? Culture. Because again, remember that what we're after are bacteria, no, for culture. Now, if ato siyang mauna sa urinalysis, pwede mang good that makontaminate siya further, no? Or mag-deteriorate po siya further, no? Imagine that your urinalysis, your urine will be exposed to the machine if automated na, and then of course mag-transfer pa. So less chances na good of, in a way, recovering the bacteria, possible ma-deteriorate po siya. So for us to be safe good, para maka-isolate with kagaw, because that's important in culture, unahon din nato ang culture. Alright? And then after culture, okay, ihatag na siya sa CM na specimen for urinalysis. Okay? Because in a way, for urinalysis, wala man after yun kayo sa bacteria. Because what we're looking after is the chemical parameters and the microscopic food. Although apil ang bacteria dito, pero in terms of identity of the bacteria and the characteristics niya, hindi na siya labot sa urinalysis. It's in the microbiome section. So if ikaw CM intern ka, no, kadawat ka og specimen na na-requests for both urinalysis and culture, ihatag sa ng urine dito sa microbiome. Okay, kaya na-culture una. And then ina lang itong medtech dito na, ma'am, pakibalik lang sa specimen after of process. Kaya ako siyang i-process for urinalysis. Okay, daghan kayong cases kita na, dear, promise, I'm telling you, maka-experience mo na po sa hospital assignment ninyo. Nagyod na. Alright? So be careful po. I emphasize po, dears, na ibang hospitals na nai-interns ma-assign sa receiving section. Mag-example ako sa Soto, no? Ang Soto, na laboratory, 3 floors na siya. Pa ako, di ba? Social, bongga. ang first floor dito ang receiving area. Dito po ng phlebotomy area. Ang second floor is the routine na lab. Na dito ang HEMA, Clean Chem, and ISBB na IS na section. And then histopath. Ang third floor kay for micro ragid siya. Now, there will be interns na ma-assign sa receiving area. Alright? Now, it's the goal and it's the job of the receiving area interns to check sa quality sa specimen. Do I reject this specimen ba or do I accept this specimen? Muna na role sa mga receiving area, of course. Now, there are some instances na ang receiving area interns kay angach-angach, katanga-tanga, no? Gadangag. Alright? So, let's say gihatag gradayon ang urine sa imuha, CM intern. Okay? Wala siya kabantay ng request form na aday culture. Okay? Now, ikaw po mismo, CM intern, wala po ka naglantaw sa request form, pakita rin mo na urine agad-agad, di mo na pong i-process sa urinalysis. Pero wala pa na culture. So, what happened is, pag kumain mo process sa urinalysis, imo nang labay ang urine. Imo nang ibutang ang disinfectant. Then, pag check mo balik sa request form, pak! Aday culture. Shock. So, paano na to? Ano nang mangyayari sa akin, sir? IR, extension, charot, bitaw. So muna siya, dears, I highly emphasize, ha? If nagdangag-dangag mga ganitong receiving intern, okay, ikaw na lang mismo, ayaw po pagdangag, alright? You have to always check the request form, no? Especially if kanangina ng mga specimens na usara ang specimen for daghang tests, okay? So you have to look at the request form. Unsa yung kailangan? Urinalysis na ba? Or na ba siya culture? If gibutan dito na UA ra, okay ra. Pero if na culture, of course, nahon ang culture. Alright? So, ako i-share na experience na yun, Ana. Ako mismo ang nagdangag-dangag. Okay, anyway, na pong experience, not really ako ang experience, pero co-intern ako sa Velez, no? Hindi siya from, ako nag-mention ng ngalan, ang school. But anyway, sige lang. Hindi siya from Siliman, no? So, during my time sa Soto, na-call ang attention, na I co-intern ako, yes, from a different school, magdili ito letter B. Na kanang nakadawat siya body fluid. Ayan. Kadawat siya body fluid. Dili urine ha. I think it's pleural fluid. Now usually kana mga pleural fluid dears, kana mga body fluids, they usually have different tests. Daghan kay siyang test, of course. You have body fluids na iba na histo, of course. Magpagama og cell block for histopathology. And then napoy mga, of course, chemical tests, so chemistry, cell count sa HEMA, and of course, culture. Okay, now what happened sa iyang kagaral, kayang kadangag, o siya galang sa request form. I think basin stressful na siya. Stress na po siya to kay night duty na gito. Anyway, mo to na itabo, no? Since nakadawat siya og body fluid, since nag-think siya na body fluid to siya, so ga-think siya na histopath agad-agad. So what he did, or what he or she did, kay iyahang gibutangan dayon og formalin. Yang paglataw di ay to na ay culture. So if nanay formalin dear, so nanay pulos ang culture, kaya nangamatay ng kagaw dito if naa. So therefore, ano nangyari sa kanya? Extension and even IR foot. Because that's a body fluid. Alright? So lisod kaayo. No, lisod kaayo siya ipangitaan og solution in a way. Kay body fluid nanay formalin. So kung naagapan to agad-agad, siguro na pa'y mutubo gamay. Pero if nadugayan na to, kung anag yun, the effect ng formalin, namatay na itong mga kagaw. Alright? So muna na hitabo. No? Ako ng point again, ako i-emphasize again, look, no, read the request forms carefully good. Ha? As in, double check kung check to batanan, alright, kay lisod na magkamali because it's always a life at stake. Alright? So imagine na, nasa ka pleural fluid, ikaw na ko ang pleural fluid, kasakitan na, diba? Charot, diba? So, very important. Okay? Ang mga experiences dyan. Okay? So, take note of that. Alright? So, kung magdungan ang specimen, no? Magdungan ang request ang culture and urinalysis in one specimen, so to prioritize culture. Alright. Okay. Sige. Now, again, what are the reasons for specimen rejection? Alam nyo na yan, of course. The most common reasons why we reject specimens in the ClinMic laboratory for urine is unlabeled and, of course, mislabeled. So, unlabeled specimens meaning wala gyud siya label, and mislabeled meaning nasayop og label. Alright. Another situation. Oh, sige, nakatanan ko mga situation na real life situations yun siya, dears. Let's say na ay watcher. Alright. Nurse na lang, nurse. Sige, watcher or nurse na lang, ana. Yato sa lab, no? Receiving area na pud ka na intern. Okay. Tapos, ihatag siya og urine nimo na sample. Alright. So, imong gi-check. Okay rang volume, so carry na. Pero, iyahang label, alright, iyahang label, sayop. Alright? Sayop ang label. Wala nag-match sa imong request form. What are you gonna do as an intern? Sa yung buhaton. Ito'y chika na to. Sayop ang label, no? Yung gidala na siya sa watcher. Sige. Sa yung buhaton.
Reject, sir.
Reject the specimen. Okay. Alright. Ito kailangan. Sige. Inform the RMT. Okay. Pwede side. Pwede ba? Sige na, kailangan answers to that situation. Confirm. Confirm from the requisition form. Okay. Na-confirm na mo siya. Okay, kay kabalo ka na sayop ang label sa body, sa container, and sa wala nag-match. Alright? Sige. Other answers possible sa inyong buhaton ha. Situational ni dear sa, and it really happens in internship, in real setting. Sige. Reject sir, tas ibalik sa watcher, ipalabel sa nurse station. Alright. Okay. So, very good. Sakto tong answer ni Lujing. Alright? Take note of that, dears. Basta gani, walay labeled or mislabeled, dili jud ikaw mo change. Ha? Dili jud ikaw mo change. Alright? If gipadala ra ang specimen, like gipadala ra gyud ang specimen, if sayo pang label, you call the nurse station. Ingna na ma'am, kanang sayo pang label diri ma'am, amo ra ipabalik dira, paki-label kung tarong, and then ibalik ra diri og send. Alright? Or if ang watcher ang nagdala, watcher meaning katong nagbantay sa patient, like parent ba siya, family friend, whatever, pwede siya mo label. Basta kaila siya sa patient. Okay? Siya mo label. Pwede siya rin mo label. Alright? Okay, so yun na. Basta ikaw, dili ka mo label. Dears, sa dili na tandapita, dili mag-label. For the rest, mo label na tanda. Okay, diba? So take note of that. Basta mislabeled or unlabeled, pabalik yun na siya sa nurse station. Very good. Take note of that. Alright? Okay. Now, what are the reasons for specimen rejection? Of course, specimens in unlabeled containers, non-matching labels and requisition forms, para sa akong example, specimens contaminated with feces and toilet paper, of course, containers with contaminated exteriors, specimens of insufficient quality, that's QNS, dears, quantity not sufficient. Yes, ginagamit na term sa lab, QNS. Specimens that have been improperly transported, urine collected in a container with detergent, residue, or bleach, and urine squeezed out of a diaper. So of course, ganun dili pwede ang gikan sa diaper because it can introduce diaper fibers into your specimen. And these diaper fibers can be challenging, no? Can be difficult. Can make your examination difficult, especially sa microscopic examination. Number 7, nganong dili pwede sa detergent, residue, or bleach, of course, because of the interference of bleach with your chemical reactions. And number 5, QNS, ayan. Specimen of insufficient quantity. Nako, another situation. Ito, mga real-life dyan siya, dears, promise. Trust me. Maka-experience mo, makaingon ko na. Ay, chak to bitong ni Sir Mark. Ay, na-experience ko din siya na ako. Sige, let's say, na-watcher ha, watcher. Dala siya ihi, no? Receiving intern na puga, ikaw na receiving sa first floor sa Soto. Let's say Soto ka. Okay. Then yun siya, pag-check mo sa ihi, gamay jud kay siya. Like, gamay jud siya. Now, let's say katong fruit salad na container nato. Nara siya sa pinakailanong gamay, radyo kayo. So, pag-ask ni mo ni sir or ni ma'am, sir, ma'am, anong gamay kayo ni? Kanang basin maglisod mi o process ani. Okay? Yan mo yun naman ang mo yung ka na, of course, na, di ba, ano man ta, reject, di ba? Reject, kay gamay man og quantity. So, may ka na, ay sir, dili mi pwede ani, kay gamay, jud ka ayo lang ihi, dili mi ka process ani. So, may po itong watcher na, ay sir, or ma'am, kanang bata, magod ang pasyente, niya, lisod jud kay siya paihion, kay dili man good siya, dili siya muingon kung ano siya muihi niya, gamay pud kay siya muihi. Ikapila na mo siya gipainom og tubig, pero gamay ra jud kay ang iihi. Nako, kana jud ng mga linya, very common kaayo sa mga watchers. So if in ana situation, unsa man imong buhaton as an intern. Ningon gyud siya na, sir, ma'am, di gyud kaya gyud kay bata, hinay jud kay siya muihi. Lisod jud kay mo ra gyud na kaya. Sige, unsa man imong buhaton as an intern. Wala, yes. So, situation ha. Reject Japon. Okay. Okay. Si Lujay daw, yun. Walay patawad si Lujay. No mercy. Reject yun. Okay. How about the others? Will you reject immediately? Or na may buhaton lang? 3 years na lang, sir. Take note lang sa specimen, sir, nga batang patient. Test lang sa ego matest. Test lang sa ego matest. Okay, tapos, as an intern, what you can do as an intern? Dili pa sa medtech. Okay, as an intern lang. Alright, sige. Okay, so na-mention si Luje, reject na gyud. Si Feli, ningon siya na i-take note na batang patient. Pahulaton hangtod makaihi o taro. Or what if stat siya na urinalysis? Or like what if kailangan siya dayon? Okay, di yun necessarily stat, pero need siya. Di na siya kahulat. Okay, sige. So, ni-mention na to si Luje, reject, si Feli, kaya sa to, ipa-note ra, then si Ron, kung hantod ra asa makaya. Then si Lenos, kay pahulaton yun. Then so chemicals. Alright, sige. Katitir. Luya niya, batang pa siya, hindi mo katitir. Sakita ko eh, charatu eh. Anyway, sige, any ano pa, any possible na itong buhaton na realistic and practical na po. Sige. So far, valid yung mga answers din naman, majority, okay lang din. Alright. Okay, sige. Alright. Spirits of laughter lang. Ikaw mo perform, Ron. Alright. Okay, so for beginners, no, the best thing to do as an intern, okay, as an intern is to consult your medtech. Okay? Ipakita sa ang specimen, mo ask dito, ma'am, sir, okay na ni mo ni na ma-process ba? Kaya naman ko yung bang medtechs na musugot ra. Okay? Kay if ever in ana maganif, gamay ra jud kay ang specimen, no? Remember that again, in a way, ibalin pa man siya sa tube, no? So kung gamay ra kaayo, if gamay kay ang specimen, expected na good ka na, dili na mo na siya ma-process sa machine, no? Kaya the machine would require you a higher volume. Oh my God, nawala akong connection. Hello? Hello? Okay. Ako din camera, sorry. Ako na ako connection. Okay. Ayan, di ba? Nagbalin ako. Anyway, akong point, dears, is, ano sa to? Sa to, nawala noon ko. Nawala na ako. Wait lang. Again. Ayun, depende siya sa medtech because na yung bang medtechs na mo agree ra. Alright? Naari medtechs na mo agree. So again, if gamay na kayo ang volume, dears, expected na yun na, hindi mo siya ma-process sa machine because the machine would require you to process it in a higher volume. Okay? So, ang imong buhaton na lang yun, Ana, is manual. Alright? So if makaya na siyang manual, i-tilt yun maayo ang imong test tube for chemical. So, okay ra. Depende sa medtech yun ang mo process. Pa-proseso na po ka, pero if ang medtech mo yun siya dito na okay ra, kaya ra na siya, then you accept it. Pero theoretically, yun dapat i-reject siya. Pero if mga bata, mga good years, lisod yun siya pa iion. No? Medyo gamay na yun kailang volume. Okay? So, mga nana dears, muna siya akong i-mention po na not all that is placed in theory, not all that is discussed in the theory can be applied in practice. Nagyo yung mga tweaks, no, na yung mga changes gamay. All right? Para ma-adjust sa mga needs. Okay? All right. So that's mga situation dear sa, and as I mentioned, that's very much realistic. May tabog yun siya. Okay? All right. Sige. Ay nako. All right. So that's those are the reasons. No, very self-explanatory ngano ta mo reject og specimen. Okay. All right. Now we go na to specimen handling, of course. For handling specimens, again, it is required and it is best to submit the urine, no, the sample as soon as possible, no. And if di man gani kaya, at least within 2 hours to the laboratory. All right, because physical, chemical, and microscopic characteristics of the specimen will change as soon as nakaihi na ang patient. All right, so if madugay pa, mas daghang changes na mahitabo. Okay, all right. Now we go na to the different types of urine specimen. Wait lang, dears. Ako sa i-check. Ako sa tarong akong camera. Wait. Okay, ayan. Madungan ako, Karina. Kuyon po ko. Alright. Okay na, dears. Nadungan ako, no? Basta niya. Ano,
Yes, sir.
Okay. Alright. So, thank you. Now we'll start with the different types of urine specimen. Alright. Now, the first one is, of course, the random or occasional or single na urine specimen. So, by the name itself, random, any time of the day, no? So, this is usually used for routine and qualitative analysis. Alright. So, kanatong paghatag or usually the specimens we receive in the laboratory, random yun na siya. Okay? Now, number 2 is first morning. Now, the first morning is considered to be the specimen of choice good for urinalysis, all right? Because this specimen is the most concentrated, all right? And also acidic, the most acidic. So there is well preservation of your cells and casts, all right? And because it's really concentrated, dears, so tanang solute sa nasa urine, makita nyo dito na concentrate siya. So therefore, it's really best for orthostatic proteinuria evaluation, and even routine UA and pregnancy test. Because again, concentrated kayo solutes, no? So, less chances gyud of false negative. Okay? Because even if gamay ra kaayo ang amount sa solute na nasa ihi, because the fact that it's really concentrated, it stayed in the bladder for pila ka hours, then the higher chances of detecting it. Bahala gamay ra iyahang amount. Okay? That's the advantage of first morning. This first morning urine is following the principle that urine stayed in the bladder for approximately 8 hours because this is the urine that you void or mangihi ka after arising, immediately after arising in bed. So makating ka na, sir, what if late ko tigmata? What if alas 12 ko tigmata, sir? First morning bagya po na akong ihi pag ihi na ko ana. Yes, basta imong unang ihi na mapagawas pag bangon nimo. All right, that's first morning. Okay? All right. Now, kanang orthostatic proteinuria, dears, sa chemical exam na ako i-discuss. Okay? I'm sure alam niyo na yan, pero dito na natin i-discuss. Okay? Now, second morning fasting, of course, it's the second voided urine after a period of fasting. So, it's usually used for glucose monitoring. So, for diabetes. Next, you have 2-hour postprandial and glucose tolerance test again. Still the same for diabetes monitoring, for diabetes detection. No? Glucose tolerance, it's actually same with your OGTT. No? Imong i-pair parisan nimo og urine samples imuhang blood samples. But generally, ang OGTT di na kailangan ng urine samples. The blood samples would suffice. All right. Fractional specimens still the same, no? There are series of blood samples imo siya i-partner with urine specimen. And then imo i-compare ang concentration of the analytes, example glucose sa blood and then sa urine. So still the same, it's used for diabetes. All right. And of course, you have midstream clean catch. All right. Midstream clean catch. This is the most common, most common method na itong ginagamit. Alright, so it's still used for routine UA and even bacterial culture. Now take note, if na-I culture magani, urine specimen, midstream clean catch, dapat the patient should in a way wash iyahang genitalia with soap and water or pwede po wet wipes daw, kato mga wet wipes, no? Because again, to prevent external contamination or to minimize external contamination of the normal flora in the genital tract. Okay? So again, if na-culture niya midstream clean catch, dapat i-wash ang genitalia with soap and water. Pero if wala na-culture, pwede ragwala. Okay? Now, very important, dears, because this is the main method, yun. Most common method na itong ginagamit, no, for urine collection, especially in hospitals, no? So, very important ang patient instruction. So, dears, ha? So, I'm sure na iba nato diri na maglisod pag Bisaya, natin mga friends do na mga spokening dollars gyud, mga English akong gingnan si Jeremiah last katong morning section, and also si Andrea Patrimonio, yes, mga ato mga English friends, no, na dears, you have to start practicing how to speak in Bisaya gyud because you know it's very difficult. Lisod kaayo mo instruct in English samot na sa mga patients, no. When you're assigned in public hospitals, of course, you are to expect that not all patients are English literate, okay, and that they know how to speak English or they can really converse well. So ato ang para murag neutral ra tag yun, wala tay away na makita dito, magbisaya ra kita. So proper instruction to the patient. So how do you instruct the patient? Sir, ma'am, palihog, imuhang tunga-tunga lang sa ihi ang imuhang isalod. Alright? Ayaw isalod ang unang ihi, tunga-tunga lang na mugawas ang imuhang isalod. Okay? Ina na itong instruction ha. Basta midstream clean catch. Okay. Alright. Take note of that, dears. Kaya mo instruct mo na sa patient, especially if mato mo sa mga public hospital. So, Bisaya gyud, no? Bisaya gyud. Ma-challenge nyo ang Bisaya dito. Pero carry naman. Okay? Alright. Now, your midstream clean catch, dears, can also be used for cytology. Ayan. Now, for cytology, as you can see, na yung mga instructions here, na dapat na ay water, hydration, mo drink dapat ng patient of about 24 to 32 ounce of water for 2 hours before urine collection. And to increase cellularity, meaning para mas daghang cells na ma-detect, alright, dapat ang the patient may exercise for 5 minutes by skipping or jumping up and down before specimen collection. So, you can isa Branzel, dears. So, imong mention clean catch if cytology ang purpose, meaning to detect the cells found in urine para makadetect ba kag mga cancer ba sa bladder or whatever, no? Ayan, dapat mainom siya water. Ayan, 24 to 32 ounce, alright, of water for 2 hours before urine collection. And again, to increase cellularity para daghang cells na ma-recover, alright, the patient may exercise for 5 minutes by skipping or jumping up and down. All right, that's additional information lang from Branzel. Okay, so that's the first type of your urine specimen. Again, the midstream clean couch. All right. Next, of course, you have the catheterized. Okay, the catheterized specimen, of course, usually seen in patients na maglisod na og pangihip, no? So a catheter, it's a flexible tube that is inserted into the urethra, padulong sa bladder, para siya ang mukuha sa urine. All right. Now, you're expected na, of course, since diretso man, gikan man sa bladder ang ihi, muagi ra siya sa imuhang catheter, which is sterile, supposed to be, then you are expected na ang urine po na mo gawas is sterile. So this is ideal for bacterial culture. So kana mga catheterized specimen, usually, it's for bacterial culture. Alright? So again, para sa ani, no? Ayan. Since magdiso na silang ihi, usually seen mga patients na may prostate cancer, no? Manghubag ng prostate. So this is the prostate. So ma-press na ang urethra. So di nakagawas ang ihi. That's why kailangan o catheter. Okay? Alright, ayan. So again, ang disadvantage sa catheter is possible lang po na maka-introduce siya bacteria sa bladder. Kaya imagine, di ba, muagi siya sa urethra, imuhang catheter. So possible na madala niya ang bacteria na normal flora sa urethra, padulong sa bladder. So it can cause infection noon. Alright? That's the disadvantage lang. Alright. Next is, of course, suprapubic aspiration. By the name itself, suprapubic aspiration, diretso, no, from the bladder. So using a needle, a syringe, aspirate ka og urine from the bladder. So diretso man siya from the bladder, so you are expected, or you can expect that this is the most sterile specimen. And again, this is usually used for anaerobic cultures, all right, bacterial cultures, di ba? The best specimen for anaerobes is your aspiration. And of course, this can also be used for infants. Because again, if someone type lisod silang mangihi, di ba? Di po sila mo ingon, kano sila mangihi, di ba? So of course, pwede suprapubic aspiration. But again, the disadvantage is it's very invasive. Okay, all right. Pediatric specimen, of course, as we mentioned, the pediatric na population, mga infants, mga basta less than 1 year old, mga nana, medyo lisod yun na sila paihihon, no? So one of the ways para dili po ta mag-suprapubic sigi is through the use of this pediatric collection bags in any deers. Very common po ni na ma-receive po sa laboratory. Now take note, kani siya deers, kani siya, this is plastic, no? Kaning yellow, this is adhesive, no? Na siya adhesive, meaning mapatapot na siya. So how do you attach that? Of course, ang genitalia sa bata, imo sa siyang hugasan, no? Para dili siya, wala kay contamination. Now after, imo siya ipatapot, kaning yellow sa iyang genitalia, alright? And imo na siyang i-wait, imo na siya ipatapot there, and mag-wait na ka na mangihi siya, alright? And kaning collection bag, siya na ang mag-collect ana. And it is mentioned here that once the bag is in place, the patient or the baby or infant is checked every 15 minutes to see if ang volume na na-collect sa ihi kay enough na for analysis, okay, or for urinalysis. Alright? So, makadawat yung mga dear, siya kapilan ako nakadawat sa laboratory, okay, in ani. So, nana siya, dito, like, let's say, na kay watcher na po, na muan to, sa lab, na parent, no? Makaino siya dito na, kanang, ma'am, sir, lisod yung kaayo pa, ihihon akong bata, kay dili ko ka-timing na mangihi siya kay usahay sa makita na lang nako na yung diaper kay basa na o inana kay wala siya wala nangihi na day siya pero wala ko ka kaapas na. So pwede kang instruct na, sir, ma'am, kanang naatay kanang pediatric collection bag kaya ipatapot lang na siya sa iyahang tintin or sa JJ and then pwede din mo siyang biyaan din i-collect ra iyang ihian na mapalit na sa mga pharmacy. So inanay mo ang pag-instruct. Di ba, there's na mga rapport, no? Mga rapport, mga chika-chika conversation with your patients, good promise. Sige na mawala, as in. Not only in phlebotomy, but even in mga specimen collection. Alright. Now, speaking of phlebotomy, dear, so lang ako na-mention ganina. When, okay, especially mag-warding mo, I really wish makatry mag-warding. If mag-warding mo, especially mag-warding mo, when should you label your blood evacuated tubes? Before collection of the blood or after collecting blood? Sige.
After.
Okay? After? After ba? Tama ba? Agree ba kayo, After na collection of blood? Okay. Alright? Yes. Thank you, Shra. Alright, very good. Tama. After. Take note of that, dears. Kaya again, based on experience sa Soto, no, since dagan kang wardan, usa ka if ma-assign mo phlebotomy sa Soto, 2 weeks ang assignment na in one section para sa mga sa una, pero basin sa inyo na changes. So if phlebotomy ka, usa ka shift nimo like 8 hours, ika-upat ka mag-ward or ikatulo. And then ang usa ka warding session nimo hatagan kag minimum of mga 15 na i-ward. Maximum na ng mga 30. Grabe, shucks. Anyway, ayun, or mga mga inana, mga 15 siguro ang minimum or inana. Anyway, so may tabo mo na kay mura kapuya na ka, di ba? After collecting blood, label na po ka, kalasog time. Dagan pa kay kang kuwaon. But bahala na basta mura gyapon imuhang i-follow dears. After gyapon og blood collection. Kay naka-experience ko before natin mga interns na gi-call ang attention because they were labeling tubes even before no collecting blood. So we call ilang attention kay ganong inaniman because again that's really prone to misidentification. Let's say na daghan na kay kang tubes dito nya gadali na ka nya nasayop nimo pansak tong blood or transfer ang blood to the sayop na tube. So very risky yun. Okay? Ang imuhang pag-label jud dapat immediately after. Pag mahuwa na ka sa patient, nag-patient care na ka, mo thank you, label gyud ka dayon, okay, sa tube. Ayaw nagpadugaya, ayaw nag-ingon na, ay, sa lab na ko mag-label. No, dapat dili. Agad-agad jud dayon, alright? Agad jud dayon, agad-agad yun. Okay? Immediately after collection of blood. Okay, take note of that. Alright? Sige, very good. Okay, sige. That's for the pediatric specimen, o, diba? Na-insert na ko ning ano. So that's for pediatric specimen. Next, you have the 3-glass technique. This is usually used for prostatitis. Okay? Now, take note for 3-glass, nasa pangalan na 3 ka specimens mo i-collect. The first specimen is your first portion of the voided urine, like first portion of urine. Second is middle portion of voided urine. And the third is urine after a prostatic massage. So, of course, the first portion of the voided urine will represent urethral infection if naa, and the midstream is for bladder infection if naa. All right. Now for prostatatic infection, you examine the first and third. If the number of WBCs are higher in the third specimen, which contains the prostatic secretions, that could indicate na nasa prostatic infection. Pero kung ang second specimen rather, ang daghang WBCs, then it means an bladder or kidney infection. Because remember that the midstream clean catch or ang midstream portion, siya mo represent sa kidneys or sa bladder. Remember that ang midstream clean catch, muna siyang midstream rather collect because the first stream of urine, siya mo flush away sa mga urethral normal flora, urethral na mga contaminants. That's why ang imuhang midstream, siya ang mo represent sa kidney and bladder na mga infection or state. So if mo positive na siya sa 3-glass technique, it means that the cause of the bacteria or WBCs na nasa third specimen is because of the bladder infection. Okay? So it's not because of prostatitis. Okay? So nanay infection daan sa bladder or sa kidney because nanay WBCs nakitaan sa second specimen. Okay? Alright. So second specimen siya ang control, control for bladder and kidney infection. Now we go to the timed specimens. Of course, usually we perform this for quantitative testing. No? So we have the 24-hour, 12-hour, 4-hour, and the afternoon. So take note, you have the 24-hour, of course, gahapon nakadiscuss ta creatinine, all right? So you begin and end with an empty bladder, no? It may require preservative depending on the test that you perform, all right? Now, usually for 24-hour, usually refrigeration lang, di ba? You experience it na. Basta mag-collect mo, dears, after collection, balik sa refrigerator na po. Basta dapat within, nasa sa refrigerator. Okay? Alright. 12-hour for Addis count, di ba? Addis count is it's a formula for determining total solids na to. 4-hour, it's for nitrite determination. Anong kailangan ng 4-hour? Because we need this time na ang nitrates na sa itong ihi, mustay siya sa bladder para ma-convert siya sa mga bacteria to nitrite. Okay? Muna siyang 4 hours ang kailangan. Alright. And afternoon is urobilinogen, 2 p.m. to 4 p.m. Take note of that. So, ani na time, no? At ani na time sa itong lecture, it is at the peak of production of urobilinogen. So, it's the best time to collect urine sample for urobilinogen determination. Okay? All right. So, that's for your timed specimen. Now, take note, dears, you may be wondering, sir, gano'ng kailangan of 24-hour urine for creatinine clearance? Because these substance, creatinine is exhibits diurnal variation, meaning nasa mga times in the day na dili constant iyahang murag concentration no in the sample. That's why para ma-cover na to tanan, okay, because of this variation, we collect a 24-hour urine. All right, that's the principle why we collect 24-hour urine, because creatinine exhibits diurnal variation, meaning mag-change siya, no? Dili siya constant yung concentration CB. All right, okay, so para makuha na to tanan, no, 24-hour urine atong gamitan. Okay, all right, that's for the different types of urine specimen. Now, the last is, of course, a drug specimen collection. No? Take note, drug specimen collection. Basta ganin mo collected specimen for drug testing, which is usually urine, no? For routine, kay mga drug test kits, of course, you experience that in ClinChem. It should follow a chain of custody or also known as chain of evidence. Ayan, lumabas sa inyo ang pre-test. So, chain of custody or chain of evidence. Now, the main gist or the main principle lang, dears, of chain of custody or chain of evidence is that from the start of sample collection until results, there should be proper documentation. Because again, remember that the results of these drug tests, they are usually used for legal purposes, no, mga legal cases. So kailangan din from the start until the end, tanan yun documented because all of this can be used for legal cases. Excuse me. All right. Okay. Ayan. Now, required urine volume pila 30 to 45 ml, and the capacity should be about 60 ml. The temperature should be checked within 4 minutes, and the temperature should be within 32.5 to 37.7 degrees Celsius. Below and higher than that, then it should indicate that the specimen has been tampered or adulterated. All right. Now, bluing agent or dye is added to toilet water para dili siya ma-prevent ang specimen adulteration. All right? Because again, di ba, adulteration is any means, no? Any means of tampering your specimen. Because again, of course, if ikaw madawi itong mga drug cases or inanang, you want to make sure na ma-negative yung ka para wala yung ma-prove or anything, di ba? So, that's adulteration. And again, what is the most common adulterant na ginagamit? Most common, you have most common. Okay, it's liquid. Okay.
Water,
Most
sir.
common, it's your
Water.
water. Very good. For the most effective is your bleach. Take note of that. So bleach is the most effective adulterant, for the most common is water. That's why naka-experience mo pa drug test ka ng mga mukha license nila. Usually ang CR sa drug testing, di ba, ng murag laboratory, walay water. Based ako experience, no? Because of that reason, kaya pwede siyang gamiton as adulterant. Now, if ikaw as a medtech in the future, if mo work kind of drug testing laboratory, you have to make sure, you have to be very aware, no? Very keen, K-E-E-N, very kanang keen yun, very specific to your specimen. Imo siyang isimhuton yun, no? Dili yun diretso, pero imo lang isimhot. Or lantawon yun mo ang color na may changes, no? Because of the possibility of adulteration, okay? If na gani siya bleach, as in strong yun na siya na smell, no? Makasmell ka sa Tide or sa Ariel na yung gigamit, no? Maklaro gid siya, alright? So it's your job as a medtech to be really honest, no? And to be efficient in performing it and be honest in performing good. Okay, take note, these are really used for legal cases na base ma-appeal pa noon ka. Alright? Okay. Ayan. Next, you have, of course, the last specimen for prostatitis. You have staminears, no? Ang difference na kay upat iyahang specimen. Number one is BB1, which is katong first voided, para siya sa 3 class. Second is midstream. Third is prostatic secretions lagi yun. I-massage ang prostate and then mugawas to mga prostatic secretions, alright? And the fourth is the urine after the massage, okay? Alright. So kung VB1 na ay mga WBCs, then that is indicative of urethral infection or inflammation. VB2, if na ay mga bacteria or WBCs, of course, urinary bladder infection. And for prostatic secretions and katong urine, you check for possible na WBCs, and if na ganing, then that indicates prostatic infection. I forgot to mention, dears, another prostatitis specimen kanidi ay pre and post massage test. So similar gyapon na sa Strasinger, mangihis ang patient, that's pre-massage test. Then after a while, i-massage ang prostate, okay, and then mangihin na po siya, post-massage. And then i-compare ang number of WBCs. If mas daghan ang post-massage, then that indicates prostatic infection. Mas simple ra siya. So how do you massage a prostate? Of course, i-insert ang fingers, usually 2 fingers, into the anus of the patient and then i-massage. No? Very familiar. Charot, I miss. Tsaka lang. Okay. Alright, charot. Okay. Marami na sa inyo ang prostatic massage. Charot lang, tsaka lang. Okay, alright. Now we go na to the different changes. Ayan, different changes in unpreserved urine, no? So, kinsa tong increased, kinsa tong decreased, kinsa tong darkened or modified. So, of course, ay mo na i-take note, dears, para easy ang life is kinsa tong increased. And we have a mnemonic for that. Of course, alam na nito ng mga students ko dyan. You have pabaon.
Paba.
Letter D, P, B-A-O-N. Pabaon. So, kani sila, siya ang increased. Everything outside of pabaon, siya ang decreased. So, take note, P stands for pH, BA for bacteria, O for odor, and N for nitrite. So take note, if inyong latawon dears, majority of the reasons nga nung na-increase, it's because of bacteria. So pH, nga naman mo increase ang pH because of the urea, which will be converted by bacteria to ammonia. And ammonia is basic. So therefore, may increase ang pH. Bacteria, of course, may increase siya because of proliferation. Odor, nga naman siya may increase because of the ammonia produced. Nitrite, nga naman siya may increase because of the conversion of the bacteria sa mga nitrate sa ihi to nitrite. Okay? So that's how you remember lang. Pabaon, no? Very easy. That's increased. The rest, decrease na. So color, of course, decrease because of oxidation or reduction of metabolites. Mudarken siya, no? Clarity, of course, turbidity because of bacteria, no? And precipitation also of amorphous material. Glucose, glycolysis of the bacteria. Ketones, volatilization. When you say volatilization, they are very much easy to evaporate. So, paspasan sila mo evaporate, paspasan sila mo gawas, so therefore, mo decrease sila. Bilirubin, of course, photooxidation, similar with urobilinogen. RBCs, WBCs, and casts, disintegration because of alkalinity in the long run. No? Prolonged standing maalkaline ng urine, maguba ang RBCs, WBCs, and casts. Alright? And lastly, trichomonas, of course, loss of motility and death. Okay? Because remember that trichomonas, wala siya cysts, trophozoite na siya, di ba? And as I mentioned, sa para, remember pa, trophozoites are very sensitive. Okay? So mamatay na po siya after a while. Okay? Pero among all the parameters, kinsa gani ang least affected, ang di na gyud siya maapektuhan, protein. Ayan, siya si President Nadine. Okay? Tuloy pa rin ang buhay, hindi siya affected. Ganun, okay? Protein. Okay? Si protein yun ang least affected. Now, take note lang, if the pH is medyo acidic and SG is high, medyo dugay ang deterioration sa imuhang mga casts because mas ma-preserve sila if acidic ang urine. Okay? Take note of that. Okay? Kinsa gani ang least affected parameter in your unpreserved urine, you have protein. Okay? Si Miss President naging Lustres naman. Okay. Now, if there are some, delays in processing, especially if madugay gud siya, no? If dali ra gud siya, dears, if dili siya mo more than 2 hours, pwede lang i-refrigerator. Okay? But if more than 2 hours na gani siya, especially if transport ng specimen, then you have to add preservatives na yun. Okay? So, ito lang i-summarize. Stable lang siya, ganung level. So, refrigeration is the most common, of course. Disadvantage lang is it may precipitate. Okay? Amorphous phosphates and urates. Pero again, it's the preservative of choice for routine UA and culture because it preserves or it stops bacterial growth for 24 hours. But take note, dears, if mag-ref ganita o specimen, di ba? Before you process the specimen, especially in chemical exam, you have to make sure that the temperature of the specimen returns to room temperature. Take note of that because again, your enzyme reactions in your chem strip is very much temperature dependent. So if cold gani ang temperature, possible na dili mo react ang reagent. So possible naman negative noon. Okay? Take note of that. Alright, so if na-ref ang sample, dapat i-make sure sa napabalikon siya to room temperature before ni mo siya i-process, especially for chemical exam. Okay? Next, you have boric acid, dears. It only affects pH. Mag-change ang pH sa sample, but it's the best. It's not the best, but it interferes with drug and hormone analyses. Take note of that. Pero it's usually used for culture because it's bacteriostatic. Okay? Your boric acid. Next, your formalin, of course, sediment preservative. Take note. So, muna siya, di ba, formalin usually, di ba, fixative for tissue. So, in a way, ma-preserve po niya mga cells or mga sediments na naasa imuhang urine. So, excellent sediment preservative. It's a reducing agent. So, therefore, ma-affect niya itong mga chemical reactions na oxidation ang principle. Okay, such as your glucose, blood, diba? Of course, we'll talk more about that sa leukocytes as a chemical exam. All right. Next, of course, toluene. It preserves ketones, proteins, and reducing substances. Sodium fluoride, it's the best for drug analysis. Okay? So kung ma-interfere with drug analysis, kinsa to na preservative, boric acid. Pero ang best for preservation of for drug analysis, you have sodium fluoride. Okay? All right. Ayan. Next, of course, you have the commercial na mga preservatives, no? So these are mga tubes, ayan. So muna siya akong pasabot there sa nasa yung transfer device, no? So kani siya ang straw, yung muna siyang insert diri, ayan. And then muna siyang ETS, no? Kani mga different tubes, yung muna siyang ipansa, okay? So kani mga conical tubes diri, dears, of course, that is for centrifugation, no? And kani mga ubang tubes diri, this is for culture na, okay? So nasa yung mga para sterile ang specimen. Now, preservative tablets, it is usually acting or iyahang action is releasing formaldehyde, okay? And formaldehyde increases the specific gravity by 0.005 per 1 tablet per 30 ml of urine. So take note of that. Ang action sa mga preservative tablets, commercial, is through the release of formaldehyde. But formaldehyde increases your specific gravity by tila 0.005 by per 1 tablet per 30 ml. Wait lang here. All right, that's for urine preservatives. Okay. Next, you have your 24-hour urine preservatives. No. So, what are the preservatives na kailangan for 24-hour urine? You have again, kato mga dili na kailangan ng preservative, i-refrigerate lang, kinsa to ng mga substances, daghan sila. Okay? Take note lang, kinsa to kailangan ng boric acid, aldosterone, and cortisol. And kinsa to kailangan ng 6N, 6 normal HCl, you have cytologic examination. Okay? So, 6N HCl catecholamine. So, epinephrine, norepinephrine. Okay. And homovanillic acid, mga breakdown products sa imuhang catecholamines. Okay. Right. Charger. Anyway, ayan, work na siya again. Anyway, ayan. And for cytologic examination, kinsa na fixative ang best, you have Sacomano fixative. Take note, diba? I think you're familiar with Sacomano fixative. I think that is histo. Sacomano fixative is usually used for histological, no? For histo. So for cytology, you have Sacomano fixative. Okay. All right. So before I proceed to the last topic for today, your physical exam, do you have any questions so far, dears? Okay. Wait lang, dears. Ako sa akong charger. Okay na. All right, sorry. So, any questions before we proceed to the last, your physical exam? Yes, Matinee?
Sir, unsa kan pag-document sa kanang sa chain of custody, sir? Like, kanang kinahanglan na mga picture or in paragraph form or murag na questionnaire something?
Questionnaire. I think, wala pa ko ka-experience ko, no? But I feel like for ano lang, based on experience, based on what I know, I think na yung mga forms na i-fill up, no? And ang imong collection mismo, pwede siyang i-witness or dili i-witness, no? So, like, when you say witness, yun, actually maglantaw na mo collect. Imagine, no, ka-weird, or wala ra, no? If witnessed ang collection, katunog yun ng mga sure ka na, ano yun sila, kanang magbinuang or something. But in terms of documentation, na yung mga forms na i-fill up, I'm not sure if na by pictures, pero feel ako na po, no? But documentation yun ang main purpose, sa chain of custody. Para at least, murag, tanan gyud ba na kay copy na note kung di mo sa nahitabo ani na stage ani na part, no, in cases lang na kailangan siya sa hearing, mga legal matters, nakakay proof or na proof na ibutaw. All right, so na dears basing ganahan mo in the future mag drug testing mo, pwede gyud kaayo, no, na siya mga training for that in the future para ma-proficient mo drug analyst, mga ganun na siya. Okay, alright.
Thank you, sir. Ug sir, kanang katabang kuan ipatapot sa tintin sa lalat sa baby, sir. If kanang mangihi, lahi ang design sa bayi ug lahi po sa bayi. Lahi po sa bayi ug lahi sa laki ang design.
Same na siya, katulad yun.
Okay, sir. Thank you.
Yes, Matt, very okay lang.
Shocks recorded on.
Okay ra. Taktura po na question. Katura, same ra gito siya, dears. Wala siya for gender. Like, lahi ang sa laki lang sa bayi. It's the same good. Based on experience, I think, of course, bata pa man siya. Hindi na mo kang mag-pediatric collection kung dako na, dears, diba? So, for bata ra siya. So, ang purpose siya ganyan kay para sa mga bata. So, their genitalia is quite small pa rin naman. So, dili pa kaayo dili ra kailangan i-discriminate, dili ra kailangan i-change or differentiate pa. Basta kato siya kaya na for both. Okay. Thank you for those questions. Any questions sa uban? Okay, sige. Alright, so we'll start now with the first part na gyud of urinalysis, which is your physical exam. Alright? Now, for physical exam of urinalysis, dears, take note that this is the first part, no, of the 3 parts of urinalysis. You have chemical and microscopic. So, sa physical ang pinakauna. Now, I have to emphasize, dears, na kanin Okay, so sorry. Madugan ako. Can you hear me? Okay lang. Carry lang.
Medyo muffled siya, sir, nga hinay.
Inay. Nalubat akong camera. Sorry. I need to, wait lang. Talaga, struggles. Alright. Okay, wadugan. Okay na. Carry na. Clear na.
Yes, sir.
Okay, sige. Alright, so pasensya na lobat akong cam, so di ko makita sa akong face. Sorry. Anyway, so we'll start with physical exam, di ba? So as I mentioned, I have to emphasize, dears, that kaning stages ninyo sa urinalysis, these are all interrelated with one another. Okay? You have to correlate between physical and chemical microscopic, and silang tanan gyud, no? So kung unsay physical, dapat inani po ako makitan sa chemical. If kaniyang chemical, unsa akong makitan dapat sa microscopic. And if kaniyang microscopic, unsa dapat yung appearance sa physical. Okay? So they're all interconnected. Lahat sila ay magkakaugnay. Alright? You should correlate it with one another. Alright? I have to emphasize that. Okay. Now we start first with, of course, urine volume. Alright. Now again, urine volume, medyo lahi na po ni siya, I think sa inyong libro kay lahi ni siya, wala siya sa physical exam. But anyway, ako ra siyang gibutang diri. So for urine volume, again, the normal range for 24 hours is about 600 to 200. But if ang question nato is what is the average volume secreted in 24 hours, it's 1,200 to 1,500 ml. All right? Now, night urine output, as you can see, it's less than 400 ml. So, gamay ra gud kay tag iihi sa gabi. Because, of course, majority of the night, kay natulog man ta. No? So, medyo gamay ra gud ang ihi nato ma-produce. All right? Now, night to day ratio, of course, mas daghan sa adlaw. No? 1:2 to 1:3. Kay mas active ta sa day, so mas daghang chances or mas daghang ihi na ma-produce. Now, container capacity, as I mentioned, Brunzel, 50 to 100 ml. But for Strassinger, yung gi-mention, gi-specify na 50 ml. Now, what is the required volume for routine urinalysis? About 10 to 15 ml. Alright? Bahalag dako atong capacity. Alright? Pero atong volume na kailangan lang is about 10 to 15. The average is about 12 ml. Alright? Because this amount can already be enough. No? It could be sufficient na for both urinometry, reagent strip testing, and even retesting if kailangan ka mo test usab sa sample. If na kay ganahan i-confirm or dili. Alright? Now, we go na to different conditions or definitions when it comes to the urine volume. Of course, number one, you have polyuria. When you say polyuria, di ba? Of course, increased urine volume. According to Strassinger, it's greater than 2.5 liters per day. But for Henleys, it's greater than 2,000 ml or 2 liters. No? So depende sa imuhang reference. For children, it's greater than 2.5 to 3 ml per kg per day. All right? So in children na siya. In children. All right? Now, what are the causes? Of course, increased fluid intake. If kusog ra jud ka mo magtubig, so of course, daghan po kang ma-produce na ihi. So taas mo urine volume. Next, you have also diuretics or nervousness. So diuretics, meaning katong mga maka-induce o water excretion such as mga drugs na diuretics and mga natural diuretics such as your tea, no, mga coffee and even alcohol, di ba? Muna if mag-shots mo, di ba? Sige magpangihi because it's a natural diuretic. Uy, charot. And of course, diabetes, no? Diabetes mellitus, diabetes insipidus. Okay? All right. Now, the opposite of polyuria is, of course, oliguria. Oliguria is a decrease in urine volume. Take note of that. Less than 500 ml per 24 hours in adults for Henry, and less than 400 ml per day in adults, according to Strasinger. In children, it's less than 0.5 ml per kg per hour. For infants, it's less than 1 ml per kg per hour. Now, what are the causes of your oliguria? Of course, dehydration. Gamay rin mong iinom, so of course, gamay ra po mong water na ma-secrete. Alright? And of course, renal diseases and renal calculi or tumor because na yung mga obstruction sa imuhang urinary tract, dili makaagi ang imuhang urine. Alright? So that's the cause of oliguria. If oliguria will not be addressed, pwede siyang mo progress, pwede siyang mo proceed to anuria. And when we say anuria, wala na dyan kay ihi. Alright? Complete cessation of urine flow. And according to graphs, it's less than 100 ml per 24 hours. So what are the causes? Complete obstruction good, like intense ng obstruction sa imuhang urinary tract, toxic agents, and of course, decreased renal blood flow. Of course, di ba? We have discussed that yesterday sa renal function. If walay renal blood flow, walay blood na mo ato sa kidneys, of course, walay urine na ma-form. Kaya unsa may i-filter sa kidneys. Okay? All right. Next, you have nocturia. By the name itself, it's increased in volume sa gabi. Greater than 500 ml of urine at night. Pero it's quite diluted. No, SG is less than 1.018. Usually, cause ani is mga pregnant women. No, so it's part of their pregnancy na magsige sila pangihi sa gabi. Alright? So be careful sa mga maburos dyan. Okay? Ayan. Now, take note, dears, before I forget, sa mga preservatives, wala na ako na-mention, there is no single best preservative good, no? For your urine, no? It would only depend good on the need of the laboratory and on what analytes that you want to examine. All right? So, mumatter dito imong preservative na gamiton. Pero in terms of the single best, wala jud. Pero ato ang preservative of choice na lang for routine UA and even culture is refrigeration. All right? Okay. Ako rang gi-emphasize to. So that's for your urine volume. All right. Now, Khadisha dears, I just have to re-emphasize, na-mention natin ni gahapon, no? Polyuria, no? When you have polyuria na patients or you have a polyuric na specimen, of course, the first thing that you can think of is, of course, diabetes insipidus. And di ba, we have discussed this gahapon sa renal function. For polyuria, the urine osmolality is low, di ba? The normal is kani, greater than 800. All right? So, for us to determine kung unsay cause sa iyahang diabetes insipidus, no, we perform the fluid deprivation test, di ba? And if after the fluid deprivation test, manormal na gani, all right, then the cause of polyuria is increased fluid intake. Kusog ra gyud siya mo inom og tubig. All right. Pero if after fluid deprivation test, gamay ra gyapon yung osmolality, mura gyapon, you have to perform the ADH challenge. So imong injectan ang patient og ADH. All right. Now after ADH challenge, ang imong osmolality na normal na, ni taas na siya, and then nibalik na siya sa normal. This means that the patient has neurogenic DI. Nga naman, kay pag butang sa ADH, di ba? Remember that ADH, iyang main function is tubular reabsorption of water. Now, pag abot sa ADH, meaning na reabsorb na ang water balik sa iyang body. Therefore, iyang osmolality sa urine mas na concentrate na. So it means na wala di siya ADH sa iyang lawas. So meaning iyang brain, neurogenic, wala nag-produce og ADH. Alright? On the other hand, if after ADH challenge, nanay ADH, iyang osmolality is still low, alright? It means that ang iyang kidneys, nephrogenic, no, especially the tubules, the receptors for the ADH are defective. Okay? So wala nag-function iyang receptors for ADH. That's why iyang osmolality is still low. Alright? So ako siyang gi-emphasize, dears, ang imuhang how to differentiate the nephrogenic and neurogenic DI. So I hope na gets lang to siya. Alright? So that's for polyuria. Sa chemical exam na mag-discuss sa DI and DM. Alright? Dito na mag-differentiate nila. Okay? Alright, sige. Now we go na to urine color, of course, no? Urine color is very important, no? Actually in history kato yung mga olden times or olden age. Ang ilahang pag-identify sa urine na mga sakit or mga changes good, it's the physical exam. So they note the changes in color, they note the changes in odor ba or in clarity, no? So color was one of that, no? And color is a rough indicator of the degree of hydration. True, because if medyo pale, medyo loose pa imong ihi, it means you're very much hydrated, no? Taas imuhang body hydration. Kay meaning na dilute imuhang sample, na dilute pud imuhang pigment. So medyo wala kay color. Whereas kung gamay kay kag water, low ra imong hydration, so meaning concentrated imuhang specimen. Okay? So mas daghang pigment na ma-produce, mas daghang color, mas dark imong color na makitaan. So increase po imuhang SG kay concentrated imuhang solutes. Okay? All right. Now again, you should correlate the color with SG as mentioned. The normal color of urine is from straw, no, colorless to deep yellow. Mga different shades of yellow. And the abnormal is of course outside of that, no? Usually ang pinaka-common abnormal is red or red-brown. Okay? Now what are the pigments contributing to the normal color of urine? You have of course number 1, urochrome. Kinsa gani naka-discover aning urochrome? You have
Tudicum.
Okay. Thudicum. Alright, wala to siya letter N ha. Thudicum. Okay, very good. Your urochrome siya ang nag-produce sa imuhang normal color of urine na yellow. Urochrome is a lipid-soluble pigment, so it is it darkens no on exposure to light. Alright, this is the major pigment that contributes to the normal color of urine. Production is directly proportional to your metabolic rate. So meaning if mas intense imong metabolism na yung mga infection or mga disease processes, mas intense pud ang pag-produce sa urochrome, mas daghang ma-produce. Kay directly proportional siya. So it's increase in thyrotoxicosis, fever, and starvation. So kabantay mo na if mag-fever mo kay medyo dark inyuhang ihi, di ba? Okay, because of that, because of intense increase imuhang urochrome production. All right. Now another minor pigment is your uroerythrin, which gives no the urine a pink color because especially if mo combine siya with amorphous urates and uric acid crystals. Okay? Siya ang makaproduce ana pink, no? Pink na color known as your brick dust. No, ayan na, siya brick dust. Okay? Ayan. And lastly, the last pigment contributing to color of urine is urobilin. Urobilin is dark yellow or orange. It imparts an orange-brown color to your urine that is not fresh. So usually, it indicates if fresh ba ang urine or dili. All right? And how do we determine urine color? Theoretically, examine the specimen under a good light source and sa container pa lang mismo, you look down sa container against a white background. So ang container, imo siyang i-place against a white background and then you look down sa container and then you examine the color na. Alright? So that's theoretically. But usually sa practice, sa test tube naman ta mag-check sa color, di ba? Pwede ra pod. Okay? But in theory, mo ni siya giingon sa Strasinger. Alright? Basin pangutan mo sa exam. How do you evaluate the color of urine? O, di ba? Ganun. Okay. Ayan, medyo ikutasan ako dire, charot. Okay, laban lang. Alright, now again, this is a table of the normal and abnormal colors sa imuhang urine. I think gikan ni siya sa gikan ni siya sa STRAS. Okay, so colorless, of course, recent fluid consumption. So, bago kang nakainom og tubig, of course. Pale yellow is polyuria, dilute specimen, no? Sige kag pangihi, all right? Dark yellow, of course, concentrated specimen, strenuous exercise, and first morning specimen, and also carotene, all right? Amber is dehydration, fever, or burns. Orange or even yellow-orange is bilirubin. Ang bilirubin po na siya yellow foam. Alright? So pag shake nimo na yellow foam na ma-produce. Phenazopyridine or pyridium na siya orange and viscous urine with orange foam. No? So phenazopyridine, dears, it's a drug. No? Usually used as an analgesic, meaning pain reliever sa urinary bladder. If na kayo ma-experience ng mga pain there, you can take phenazopyridine. Alright? Now, iyahang appearance sa urine daw kay mura siya orange. No? Orange niya viscous pagyud with orange foam. So, na-reference nag-ingon na it's similar to soda pop, orange soda pop. So, mura siya royal. Ina yung appearance. Okay? Alright, ayan. And other drugs causing orange na urine, you have acryflavine, nitrofurantoin, and phenindione. So, mga drugs for the urinary tract. Okay? Alright. Next, you have green, Pseudomonas infection. Yellow, green, yellow, brown is of course bilirubin na na-oxidize to biliverdin. So, basta na gani biliverdin na usually mga green na ang color ana. Alright. Blue-green is of course indican and mga different mga tambal, amitriptyline, methocarbamol, chlorettes, methylene blue, phenol, and chlorophyll. So, mga mouth deodorizers na sila. Alright. And other tambal. Blue-green. Pink or red, again, you have RBCs. Again, kung RBCs gani, the most common cause of red urine is RBCs, no? So your hematuria, all right? Kung hematuria gani ang patient or ang specimen, it's cloudy or smoky red because again of RBCs. Hemoglobin and myoglobin, clear red sila gyud. So, di ba? We have different ways to differentiate hemoglobin and myoglobin. We'll discuss that sa chemical exam na. All right? Now, take note, hemoglobin is clear red. Most common cause is intravascular hemolysis. All right? For myoglobin, it could be clear red, or reddish brown, or cola colored. So, mura siya soft drinks, mura siya Coke, no? So, main cause ana is rhabdomyolysis. When we say rhabdomyolysis, that is muscle destruction, no? Muscle trauma, okay? Muscle injury, no? Rhabdomyolysis. Now, take note, rhabdomyolysis, there is this group of drugs, ayan, na ang major side effect niya, dears, is rhabdomyolysis. Kinsa man to na group of drugs? Na-mention ba to? Oh my God. Kinsa man yung group of drugs na ang main side effect niya, major side effect yun, is rhabdomyolysis. So, kaning mga mutik ani magsakit ang iyahang kalawasan, magsakit iyahang muscles, no? Kinsa man. Unsa man to? Na group of drugs. Hala, yes. Kailan ko na-mention ba ni? I think na-mention ni siya. Or nakalimtan? Ikalimtan mo na ba? Unsa man to? Kinsa man to? Kinsa man to na group of drugs? Aware, kabalo ba to? Kinsa to makakause og rhabdomyolysis? Yes, very good. Sam, your statins, no? The statins group of drugs, those that lower cholesterol, okay? Kato sila ng mga drugs. You have levostatin, no? Mga avorstatin, mga simvastatin, kana. They can cause rhabdomyolysis. So kato mga mutik ana medyo magsakit ilahang lawas, magsakit ilang muscles. So one of the major side effects of your statin drugs is rhabdomyolysis. Take note of that. Okay, very good. Okay. Next, you have beets, menstrual contamination, and rifampin. Nako, rifampin. Asa ganining rifampin? This is a drug against kinsa man? Ang rifampin? Sorry. Kinsa ganining rifampin? Hala, yes? Kinsa man na drug? This is a drug against? All right, very good. TB. All right. Rifampin. Okay, very good. Again, kinsa to, unsa man is rifampin? Is this a first line agent or a second line agent against TB? Hala, yes. First line ni siya or second line? First gen or second gen, charot. First line or second line? Hala, yes. Unsa man first line or second line agent against TB? Ang rifampin. Uy. First or second? First daw, sabi ni Sam. Tama ba? Okay. Tama ba na first?
First, dagay, sir.
Dagay. Ala, sumugtang mo sa inyong bakte ha, charot. Okay. Sige, namay mo answer second. Okay, wala po. So unsa man to final answer? What is unsa man first line, second line ang imuhang rifampin as an agent against tuberculosis? It is unsa man? It is a yes, sige, ako na yung answer. It is a first-line agent. Very good. And saan ito mnemonics for the first-line agents of tuberculosis? Ako na siyang i-type there sa kay wala ko camera. You have R, you have I, you have P, you have E, and you have S. That's our mnemonic. Kung saan na mnemonic? RIPES. That is the first-line agent of first-line drugs against tuberculosis. And what does R mean? R means rifampin, ayan, which is atong gi-discuss. I stands for, unsa man ang I? I stands for isoniazid. P stands for pyrazinamide, all right? E stands for ethambutol, and S stands for streptomycin. Nako, take note of this, dears, very important. All right? So ripes, okay, rifampin, isoniazid, pyrazinamide, ethambutol, and streptomycin. Among the first-line agents against tuberculosis, which of the following is considered to be the first drug discovered, invented, and studied against tuberculosis? Among ripes, kinsa may first drug against TB? Asa man, kinsa may first ana nila?
Streptomycin.
Okay, very good. Streptomycin. Take note of that, dear sa. Ilagay nyo yan dyan. I-take note nyo yan. Bilugan nyo yan. I-highlight. So, ang letter S, streptomycin, siya ang, ni, ang first line. Pwede nimong i-change ang mnemonic. Pwede may mong spire, S-P-I-R-E, para makabalukan ang S. Kung kinsay una, siya ang first drug pod. O, diba? Spire, okay? Or ripes. Rifampin, isoniazid, pyrazinamide, ethambutol, and streptomycin. These are considered to be, again, the first-line agents against tuberculosis. Ang mga second-line agents, katulad ng mga fluoroquinolones, mga amikacin, capreomycin, okay, kanamycin, mga ganun. Okay, sila na mga second-line agents. So, kaning first-line agents, meaning sila ang mga first drugs of choice against tuberculosis. If dili mo gana or dili maayo ang patient against using this drug, mugamit ka og second line. All right? Okay. Take note of that, dear sa. Paki-take note dyan. Nako, very important. All right? So again, rifampin, unsayang characteristic color, red, no? Pink or red. Next, you have burgundy or purplish red or port wine. Kinsa may makakos ana? Porphyrins, no? So, how do you remember? Port wine, porphyrins. Por, no? Port wine, porphyrins. O, diba? Ayan. Next, for brown and black. Ayan. Kanisa medyo difficult to distinguish, no? Number one, you have methemoglobin, no? If acidic ang urine, you have homogentic acid seen in patients with alkaptonuria if alkaline ang urine, and melanin if upon air exposure or light exposure. Take note of that, no? So if na mga in practice, baka maglisod ta og differentiate kung say cause, no? But in exams, what if moingon sila dito na the urine specimen became black after pila ka hours, all right? If gi-mention dito na upon air exposure or light exposure, the causative agent is melanin. Pero if moingon na dito na alkaline urine, all right? Alkaline urine, it's caused by homogentic acid, all right? And if acidic urine, it's caused by methemoglobin. So take note of those keywords, dears. All right? Take note of those keywords. All right, ayan. Next, you have phenol derivative, argyrol, methyl dopa, levodopa, and of course, metronidazole against your amoebiasis na drug. Pwedeng mahimong brown or black ang urine. Now, another note, purple staining and catheter bags, it's caused by kinsa ng mga bacteria, Providentia or Klebsiella. Take note of that. So silang duhag yun ang dimension sa Strassenger. I think napay uban, I'm not sure if ang Proteus pwede pod, pero mag nakabasa ko somewhere. I have to confirm pa. Pero ang sure yun is Klebsiella or Providentia because of indican, okay, in the urine. Iyang i-metabolize ang indican, purple staining. Actually, nakakita ko post ani sa Facebook na nahitabog yun. Alright, na purple staining iyang urine. It's because of Klebsiella or Providentia. Alright, take note of that. Next, dears, take note, phenazopyridine can also produce yellow foam. Anay uban na dili orange foam, it can cause yellow foam. That's why sometimes pwede siyang ma-mistaken as bilirubin. Okay? So, mo-interfere siya with bilirubin, ang phenazopyridine. Take note of that. All right. And beets, ayan di ay. Beets, take note of that. It causes red urine in patients na genetically predisposed. Meaning, if mukaon sila og beets, mo color red yun lang urine because of their genes, no, genetics, no. And the cause of these red exposure or red color is due to anthocyanins. Kani siya, dears. Anthocyanins. Muna siya pigment na nag-cause sa red urine by patients who eat beets. Kani siya, beets. Alright? Okay. Ayan, mura to siya. Alright. Porphyrins daw or porphobilin pwede po mahimong color pink. But generally, it's similar to the color of wine. No? Port wine, porphyrins. Port wine, porphyrins. Okay. Alright, sige. That's for your urine color, no? Summary. Now, kanina, dears, medyo ang dami. Sir, ano ba yan? Should I memorize that? Of course, not chalk, not. Yes naman, Dean Rodriguez. Ayaw ninyo i-memorize lang. Take note lang of the most common. So, of course, alcohol, ethyl, dili sa itong rubbing. Of course, katuning shots. Of course, diuresis. So, pale mong ihi because sige kag pangihi. It promotes water excretion, no? It's a diuretic. Next, you have You have methyl levodopa, ayan, for Parkinsonism. Red, then brown, imuhang ihi, pwede siya mahimong brown. Next, you have phenazopyridine, as we have mentioned. Again, orange, red, or napo siya yellow foam. Next, you have rifampin, mentioned, bright orange, red, or red. Riboflavin or multivitamins, dears, take note, bright yellow. Ayan. So, katumatig inom og beroka dira. I'm sure you experienced na inyo ang ihi pagkahuman kay bright yellow. It's because of the multivitamins found there in your beroka. Okay? Bright yellow. So, these are just commonly used drugs. You don't have to memorize. Again, this is from Brunzel na book. Okay? All right. Ayan. Next, you have, of course, the next is urine clarity, transparency, turbidity, and character, competence, and faith. Charot yan. Siliman yan man din. Charot. Okay, anyway. So, urine clarity, transparency, turbidity, and character, of course, you determine kung unsay cause, no? Sa iyahang pagka-lubog or pagka-clear sa imuhang specimen. So, if ang question kay normal urine clarity, all right, it is clear, all right? But kung normal urine turbidity, it is the term nubecula or nabeculae. This is due to the settling of your WBCs, epithelial cells, and mucus. So this is the normal turbidity because of the settling of your WBCs, epithelial cells, and mucus. There's a faint cloud that is produced because of these WBCs, epithelial cells, and mucus. And of course, ato mga terms for clarity, I'm sure na memorize na ni, sana naman. Clear, no visible particulates, transparent. Hazy, few particulates pa, pero makitan pa ang print. Hazy is also known as slightly cloudy. Ayan. Cloudy, many particulates, the print is already blurred. Makitan pa, pero medyo hanap-hanap na, blurred. Turbid, di na yun makitan ang imuhang print. And milky may precipitate or be clotted. So sa picture, as you can see, clear, ayan. Slightly cloudy or hazy. Cloudy, medyo blurred na gyud, and turbid, di na makitan. Alright? Now, in different laboratories, they have their own terms, okay? Pero as much as possible, maano lang siya, ma-emphasize lang na ma-standardize ra ang mga terms, then okay na. Alright? Pero usually, kanina pa nang ginagamit. Clear, hazy, slightly cloudy, cloudy, turbid. Alright? Now, for urine clarity determination, how do we determine? Of course, we should mix the specimen first, and then using a good light source in front of a light source, we can use a newspaper print or any printed material. Alright? So, ato siyang i-compare against the printed material. Alright, okay. Now, bacteria, it can cause the cloudiness. And kung naay mucus, dears, it can cause the haziness. Alright? So, kung naay mucus ang urine daw, it can be hazy. Alright? Take note of that. Hazy. Okay? Alright. Now, what are the different causes of turbidity? Of course, there are a lot, no? Possible pathologic and non-pathologic. Now, for non-pathologic, as you can see, squamous epithelial cells, of course, gikan na sa urethra, no? So, mga contaminants lang. Number one, next, you have amorphous urates, all right, which contributes to the pink sediment, di ba? Uroerythrin. You have amorphous phosphates, which contributes or which becomes or produces a white or beige sediment. And vaginal cream, semen, fecal contamination, radiographic contrast media, and talcum powder. Now, take note, semen, dears, is considered to be a contaminant, no, or non-pathologic. Pero na cases of retrograde ejaculation. When say retrograde ejaculation, instead of mugawas siya sa urethra, muadto siya sa bladder. So, retrograde, bali, no? Retrograde. Retrograde, ayan, ejaculation. So, mga inana, dito na siya pathologic. Pero rare cases lang din naman. So, majority lang kay contaminant. So, if makakita kag semen or sperm sa urine, unsay meaning ana, bukod na pinagpala si ate girl or si kuya boy. Medyo bago lang sila nag-self-love or medyo bago lang sila nadiligan. Sana all. Okay? Na-edgy cases ay nana dears na makitaan gyud ang sperm sa urine of a female patient, urine of a male patient. So kita, of course, alam na. Okay? We don't judge here, no? Your practices, that's you. Okay? Ikaw na bahala, ana. We don't judge, but we know what happened. Okay? As medtechs, alam natin yan. Okay? Alright, makasana all. Charot. Tsaka lang. Alright, so those are the non-pathologic, no? So they don't point to any disease. Okay? Alright. Now for pathologic, of course, these are substances or constituents na makakos og disease or makapoint to a disease. You have RBCs, WBCs, bacteria, of course. For bacteria, uniform ang turbidity. And dili siya mawala even if i-filter or butangan og acid. Okay? And yeasts, ayan, na-mention na natin sa myco, if naka-remember pa, the main correlation of increased yeasts sa imong urine is diabetes mellitus, di ba? We mentioned that. Basta gani, makadawat kag urine specimen, nag-examine ka microscopically, kita kag daghang yeast cells, the first disease na imuhang makorrelate is your diabetes mellitus. Aside from candidiasis and other yeast infection, aside from that,
the main disease yun na mo correlate agad-agad if increased ang yeast cells sa urine is diabetes mellitus. All right. Another is non-squamous epithelial cells, so mga tubular cells, of course. Abnormal crystals, lymph fluid in cases of chyluria, such as in filariasis, di ba? Ukiriria, and of course, lipids. Okay, take note of that. All right. So very, ano naman, self-explanatory. So if na question sa exam na, which of the following is a pathologic cause, which of the following is non-pathologic, di ba? So pwede nang pwede nang dili memorize. Pwede na siyang ma-analyze or ma-enumerate or ma-eliminate di ay. Okay. Now, what are the different laboratory correlations in urine turbidity? Kinsa man tong mo precipitate and acidic urine? Of course, the urates. Take note lang, mga urates, di ba, uric acid, medyo sounds like. So therefore, mo precipitate sila in acidic urine. Amorphous urates and also your radiographic contrast media. So sila ang makakos sa turbidity if acidic ang urine. Kung alkaline urine, amorphous phosphates and carbonates. Take note, phosphates, carbonates, mga base, di ba? So sila ang mo precipitate sa alkaline urine. Kinsa to mga soluble with heat, ma-dissolve with heat, you have amorphous urates and the uric acid crystals. Kinsa tong soluble in acetic acid, dilute acetic acid, RBCs, amorphous phosphates and carbonates. Your phosphates, carbonates are again base, so pwede silang ma-dissolve sa acid. All right. Insoluble in dilute acetic acid, of course, the WBCs, bacteria, yeasts, and spermatozoa. And soluble in ether, of course, lipids, lymphatic fluid, and chyle. Take note, mga lipids, lymphatic fluid, and chyle, di ba, mga polar man sila na substances. So, ang mas dissolve po nila kay polar na solvent, which is your ether. All right? Take note of that. Sige. We have a question here, dear, from BOC. When you say BOC, katin siya mga reviewer para sa ASCPI. Sige, let's try to answer. A urine specimen collected on an apparently healthy 25-year-old man shortly after he finished eating lunch was cloudy but showed normal results on a multiple reagent strip analysis. The most likely cause of the turbidity is, ayan, sige. Ano sa man yung answer? So, para sa mga mutik og ASCPI ha, like me, charot lang. Ayan. Mas matong i-answer ani. Nag-turbid daw ang ihi sa patient, nagikan lang naniud to. Alright? Pero kanina siya na patient, healthy lang, no? Negative ra po yung mga chem strip result. So what is the possible cause of turbidity? Sige. What is your answer? WBCs, okay. Alright. So may answer sa uban. WBC lang. Urates, okay. Alright, so may answer sa uban. Napay mo answer lain? Yes, so may answer. Baka lumabas sa boards, di mo alam, no? Tigkuha na ba sila po sa BOC, ang board exam? Okay. Urates pod, okay. Any answers? Urates pod? Alright, sige. Fat. Go basta, laban lang yun. Okay. O sa pailain. Napailain mo answer. Wala pa ni-answer phosphates lagi. Answer na lang tanan. Sige. Sige, ikaw. Let's see. Let's try daw. Ikaw daw ni nag-take nag-ASCPI. Nakakuha ka ni na question. Sige. Sa man mo i-answer. Alright. Sige. So, mixin yung answer. Alright. Sige. So, atong ihimayon ang question. Alright. Now, the question says here that the man is healthy. Yan, negative pa yung chem strip. So, therefore, makaingon ka na, okay, wala na siya sakit. So, therefore, ma-eliminate na nimo ang A and B. Because A and B are pathologic causes of turbidity. Alright? So, you're left na lang with urates and phosphates. Muna lang yung pilian yun. So, unsa man tong pilion? Now, remember that after eating dirsts, ang body mo experience of what we call alkaline tide. Alright? So, meaning ana, imuhang mga H ions, H plus ions, ma-add to sa imuhang stomach for production of acid, okay, para digestion. So therefore, imuhang body mo exhibit og alkaline tide, imuha pong urine mahimong alkaline. So therefore, kinsa kanitong makakause og turbidity in alkaline urine, the correct answer here is letter D, phosphates. All right? Because again, during lunch or after lunch, ayan, the patient is healthy again, and after lunch, the body experiences alkaline tide. Okay? So, mo-alkaline po din mong urine, and i-precipitate man siya, no? Ni-turbid man siya because of alkalinity, then that is caused by phosphates. O, di ba? Imagine. Ay, asagikan siya. McBride, 1999. My gosh. Munang akong gina-specify dears kung unsa na edition akong ginagamit. Kabantay mo na, even the oldest edition pag yun sa Stras, ginagamit gyapon or mga Steininger sa hematology. It's because nagyapoy questions na mugawas dito from in the board exam, no? Halag karaan ng mga editions, gyud. Mukuha gyud sila dito. So, how do we ano that? Ato lang i-trust na lang sa atong mga notes. That's what I'm doing. I'm doing my best na ma-include to mga other editions, and I'm basing it also from my review notes para at least ma-include gyud to mga old information. Imagine inana ang board of examiner ungkata ng past. Ganun. Okay, so I hope na gets lang to. The correct answer here is phosphates. All right, ayan, sige. Di ba? It's a nice question actually. Pero if feel na ako if nag-take og ASCP ani niya, if unsa ni nag-take og ASCP niya, muna akong question masayop ko. Kaya pila ako ma-pressure na ko. Pero don't worry, sa imong ASCP ay man good. If masayop kag question na inani, depende mo guna siya na easy, medium, difficult. If masayop ka og easy, murag ang next question na pud ana kay mas easy pag yun. Then if magsikag correct, if magsunod-sunod imong correct, mas magkalisod imong question. And then if murag maabot na ka sa unsa to, imuhang sa maabot na ka sa pasar na level, okay na, like mo off na daw ang computer something based on what they say, no? So mo take pa lang ko, so puhon na, so I'll chika my experience if ever after. All right, ayan. So don't worry, no, if masayop kanina question, dili na pasabot na di na kaka-abroad. Girl, maka-abroad ra ka na ato ng target, okay? Ayan, sige. That's for the question. Very good, no? Next, of course, another characteristic is the foam, no? Kaning foam, usually it's not reported, no? Pero we can observe it, no? So we have two major qualities or appearance of foam. You have white and yellow. Now, of course, nakabante na if manghihi mo, di ba? Ang imuhang urine yun, if ma-agitate, mo produce siya white na foam. Pero it readily dissipates, meaning madali na siyang mawala. Alright? And that is normal. Alright? Pero if na white foam, pero pag agitate mo, dako kayo na foam ang produce, hindi pag siya mawala dayon, that is caused by large amounts of protein, especially albumin. So naay possible na nagyoy problema ang kidneys, all right? So pares ani, large foam, gabula-bula gyud siya, no? Ayan, so white, large foam and long lasting, mas dugay siya mawala. That is again caused by protein. And of course, yellow foam, bilirubin. As you can see, yellow ang foam and ang urine mismo, dears, lain na gyud yung color. Meron na siya brown na medyo yellow orange ganun. All right? So again, aside from bilirubin, kinsa tong tambal na maka-yellow foam pod, phenazopyridine. Take note of that. All right? Basta ang pathologic yun is white foam for protein, kung dako, and yellow foam for bilirubin. Alright, now kanina siya, dear, summary na lang. Appearance and color of urine. I think this is from Henry's. Just take note lang, you don't have to memorize. So if cloudy ang appearance, so say mga possible causes, and say remarks. Take note for fecal contamination, dears. It could be pathologic in the sense na if na ay rectovesical fistula ang patient. So what do you mean by rectovesical fistula? Ang vagina and ang rectum sa patient, so this is seen in female patients, nag-merge, no, nag-combine sila, fistula, alright, because of mga reasons, no? So that's a pathologic disease. So possible na may feces, urine, so makontaminate siya. So generally, good fecal contamination. If na feces sa urine, that is fecal contamination. Now if milky ang imuhang urine, unsay mga possible causes, fat, lipiduria, emulsified paraffin, which is seen in vaginal creams. Yellow, acrylflavine, okay, and it has a green fluorescence. All right. Next, also bilirubin, biliverdin, beers na siya, beer yellow foam. That's another description. Yellow foam, beer yellow foam. Di ba familiar? Ayan, sa mga ano dyan, mahilig mag one bat, di ba? Beer yellow foam. Mura siya katong bula-bula beer. All right, okay. Oh, I don't like that. Charot. Next, you have red-brown. Yeah, you have bilifusin, dipyrrole. It's a result of unstable hemoglobin. And heart-nap disease, dears, na siya blue-green. Yan, blue-green appearance. Ayan. This is an inborn error of metabolism. So we'll discuss this when we go to that topic. All right. And the last parameter under urine physical examination is odor. Alright, actually appeal ang specific gravity, dears, pero ako na siya i-discuss dito sa chemical exam. Kaya na may specific gravity sa chemical strip. All right. Okay. Now for odor, of course, this is not reported, pero this is one of the most evident changes good in urine na makaingon jud ka na naadjay problema ang patient kay manimaho gid siya, no? Ayan. So that's odor. The normal odor of urine is aromatic because again of ammonia, all right, and volatile acids from blood. And this term is known as urinode. That's the term for normal urine odor. All right. Now odorless o odorless imuhang ihi, that's also abnormal. All right. So dili ka magpasalamat kung dili baho imong ihi because that could indicate acute tubular necrosis in patients with acute renal failure. So asa nagikan sa Henry's, okay? So gi-mention dito na patients with acute renal failure nya odorless ng ihi, it means acute tubular necrosis. Take note of that. So if ang question kay odorless urine is caused by or is seen in patients with acute tubular necrosis. All right. Next, of course, you have maple syrup. Of course, it's caused by it's found in MSUD, maple syrup urine disease, fruity or sweet ketones, foul ammoniacal, pungent, fetid, you have UTI. Ang kanisha dears ammoniacal, take note, ang kanisha UTI meaning paggawas pa lang daan sa ihi sa patient, no? Baho na gid siya. Isog na gid yang baho. All right? Ammoniacal na gid siya. Whereas if paggawas lang sa ihi kayo, dili kayo strong iyahang smell, pero after pila ka hours kay ni strong na, that's normal because of the breakdown or the increase in ammonia. Pero paggawas pa lang daan, pagpangihi na sa patient, baho na kaayo, like isog kaayo ang baho, ammoniacal, pungent, then that is caused by UTI. All right. Mousy, of course, musty, and Barney. Ayan, I love you. You love me. Charot. Mousy, musty, Barney. This is phenylketonuria. Rancid butter, meaning kanang murag na panos na butter, na medyo sour na siya. You have tyrosinemia. Sweaty feet, of course, or acrid. You have isovaleric acidemia, glutaric acidemia, or kanisha dears, patients with excessive amounts of butyric or hexanoic acid. All right. Bleach, of course, contamination. Sulfur, cysteine disorder, rotting fish, trimethylaminiuria, swimming pool, nanimahaw daw siyang chlorine, no? Nanimahaw siyang swimming pool, Hawkinsinuria. All right. And of course, menthol like those that are taking phenol-containing medications. All right. So that's for urine odor. Kabantay mo, dears, majority good of the abnormal odors are coming from patients that have inborn errors of metabolism such as phenylketonuria, mga tyrosinemia, mga naay mga enzyme defects, no? Na mga kulang na enzymes in their metabolism of amino acids or whatever. So dira sila good mismo ang naay mga abnormal na odors. All right? Okay. So those are the urine odors of your urine odors of your urine. And that's the end of our lecture for today and our lecture also for this week. Ayan. Before we end, dears, do you have any questions? Okay.